You can flatten the curve. We are flattening the curve by what we're doing, and we're flattening the curve so far. We should all be concerned, especially New Yorkers. Well, we're flattening the curve. That's good news. It is good news. Well, now I can relax. No, you can't relax. The flattening of the curve last night happened because of what we did yesterday and the day before and the day before that. This is all a direct consequence to our actions. If we stop acting the way we're acting, you will see those numbers go up. And I show the projection models because we can't handle the worst case scenarios. We can't even handle the moderate case scenarios with all we've done. So it is essential that we keep that curve flattened because we don't have an option of handling the curve if it goes higher. The additional good news is the hospitalization rate does suggest that it's coming down, and we are flattening the curve. We had 200 net increase in hospitalizations, which you can see is the lowest number we've had since this nightmare started, actually. Change in ICU admissions is the lowest number we've had since March 19th or so. So all of this data suggests that we are flattening the curve so far, and the numbers are coming down so far. Number of intubations is down. 3-day average on intubations is down. So far, our efforts are working. They're working better than anyone projected they would work. That's because people are complying with them. You know, there are always two questions. Can you enact these policies? And then can you enact the policies in a way that people will follow? You know, we can enact a policy and people thumb their nose to it and continue doing what they're doing. So there has to be a social acceptance and adherence to the policy. And New Yorkers are doing that. They're acting responsibly and diligently, and we are saving lives by what people are doing today. Our expression has been New York tough because every day is tough on many, many levels. I get it. But every day that we are New York tough, we are actually saving lives. And don't underestimate this virus. I think that is a mistake we made from day one. We as the collective we as the global community. This virus is very, very good at what it does. We lost more lives yesterday than we have to date. We understand, and all the experts have said, Dr. Fauci said from day one to me, you will see the deaths increasing after the hospitalizations because the deaths increase the longer a person is in the hospital, the longer a person is on the ventilator. I understand the scientific concept. I understand the data. But you're talking about 799 lives, the highest number ever. It's gotten to the point, frankly, that we're going to bring in additional funeral directors to deal with the number of people who have passed. If you ever told me that as governor I would have to take these actions, I couldn't even contemplate where we are now. And to put all of this in perspective, I lived through 9/11. 9/11 was supposed to be the darkest day in New York for a generation. We've done everything we can since 9/11 to make sure 9/11 didn't happen again. We lose 2,753 lives on 9/11. We've lost over 7,000 lives to this crisis. That is so shocking and painful and breathtaking. I don't even have the words for it. 9/11 was so devastating, so tragic. And then in many ways, we lose so many more New Yorkers to this silent killer. There was no explosion. But it was a silent explosion that just ripples through society with the same randomness, the same evil that we saw on 9/11.